Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. I know you get sick of hearing this, but I'm a cosmetic facial surgeon in Richmond, Virginia. I only do surgery from here to here, and I don't do boobs, bellies, and butts. My surgeries that I just love to do are face and neck lift and eyelid surgeries, but I do almost everything else from here to here. Today, it's really important to me that the YouTube community, and I have almost 21 million views now on my YouTube channel, and I have so many followers, and thank you for that. And if you don't follow us, please subscribe and follow us as well. There's a little button here somewhere you click. But Pauline from, I believe, Omaha, sent a question in and said, "Hey, Dr. Joe, I see on your website that you have a lot of videos showing people 24 hours after facelift, etc. Let's see some more." So first, let me tell you this. It's not easy to get people to do a video 24 hours after their surgery because they look pretty disheveled and they're swollen. But thank you so much to people that do. So we're going to show you a couple, and I'll try and put their before picture up there as well. I think we have 2 patients that are 24 hours out and 1 patient that's 2 weeks out. So stick around, watch our video, and I'm Dr. Joe Niamtu, LoveThatFace.com. Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. This is one of my favorite things, and that's the 24-hour follow-up. This patient, I want to tell you, I really take pride in what I do, and my staff does also, and we want to get the best for our patients. And usually you got a good idea, you have a good idea how the patient's going to look after surgery. But every once in a while, you get a home run that you just, the result is better than you could have thought. And this is one of those situations. And this is a great patient. She's so motivated. She's in a little trouble with me, I'm not going to lie to you, because we did her surgery yesterday. Last night, she walked from her hotel to Applebee's and ate dinner. And not supposed to do that, okay?
Well, we ordered it to go. That helped.
Okay, but you're supposed to be lying in bed.
And I cut the meat off the bone. I didn't bite into the bone.
Okay, so you have to stand in the corner.
Yeah.
So basically, how was your night?
It was great. I'm in shock that I'm really not in a lot of pain. I'm just in discomfort. Turning my neck and stuff, so kind of funky, but
well, you did
I'm in disbelief.
You did really well. You did, again, and it's such an honor to be able to change somebody's life like this. And I wish I could get hair, but she got a profile much better than we had hoped for. So I'll let you take a look at it in a second. So the surgeries that we did upper blepharoplasty and lower lid laser resurfacing, so that's what you're looking at there. And we did a comprehensive face and neck lift with a lot of submentoplasty, a lot of liposuction and sculpting and removal of deep fat and platysmoplasty here. And we added a chin implant, which really made the difference. And let's turn sideways here a second. So I'm going to show you her before picture that you can see on the screen, and this is just at 24 hours. You can see her suture line, and it's just going to, let's go to the other side, it's just going to be great. I'll tell you, nothing makes me happier. Can you take a little step forward there, right there? Okay, that's good. Nothing makes me happier than to be able to perform such a life-changing procedure to make somebody look and feel so good about themselves, especially when it's something that has bothered them all their life. And again, it's a great honor. Hey, I'm Dr. Joe Niamtu, LoveThatFace.com, and one of the most common questions that we get is, "Hey doc, how am I going to look or feel the day after my facelift?" And if I could summarize this particular patient, this is how it is supposed to be, okay? I think this is perfect. And we did upper eyelids, lower lid laser, comprehensive face and neck lift with platysmoplasty and smastectomy and some deep plane dissection. And we did her yesterday, so she's 24 hours out. How you feeling today?
Oh, I feel really good. I'm surprised at how good I do feel.
Well, good. Were you in much discomfort?
Not really. The wrap that you put on me after surgery was, it was a little tight, but once you took that off, it feels wonderful.
Very good. And we put a we put a simple Velcro dressing on for the first day. For patients that like that, and some people makes them feel better, we leave that on for as long as they want. And for people that hate it, then they don't have to wear it. How about, was it difficult to sleep?
I slept pretty well. I woke up several times, but you know, I was sleeping sitting up.
Sure.
So.
And you know, you don't have to sleep sitting up, but we like to elevate the head some. But most patients say that that's, you know, one of their complaints. That first night, it's a bit difficult to sleep. And how about eating and drinking?
I didn't have any problem with that. By yesterday evening, I was ready to eat something and definitely thirsty, very thirsty.
Well, you're awesome. You're the perfect patient. What we're going to, anything you would tell somebody if they were thinking about having a face and neck lift, but were afraid of it?
Don't be scared. Don't be worried. It went like a breeze.
Well,
Yes.
that's what we like to hear, even if it wasn't really a breeze.
Yeah.
But it was, you know, again, this is just how people do in the best of circumstances. This is the, and this is what I like about patients that are motivated. You know, they study their preoperative stuff. They come here. There's no surprises. They're not taking anything that makes them bleed. They've watched my videos. They understand what we're going to do and understand the recovery. We're going to come back in 1 second and take a look at her incisions. So one of the things that's very important is we hide our incisions. So we hide them in the hairline. So when all this beautiful hair that she has, you're not going to see that incision. These incisions, you have to have them precisely at the junction of the cheek and the ear. They heal great. The incisions behind the ear, nobody's ever going to see. And the incision here is also hidden in the hairline. So the only incision you're going to see is from here to here. And, you know, I've spent decades perfecting this for a natural incision. We'll go look at the other side. Again, same thing over here. These are all dissolvable stitches, so nothing will have to come out. Hidden in the sideburn. This is at the precise junction of the cheek and the ear. Turn this way a second. These are hidden in the hairline, so you're not going to see them, and these are hidden behind the ear. So this is my signature, or the signature of any surgeon, and we do a lot of stuff under there, but the only thing that the patient or their friends or their hairdresser ever sees is the incision. And that's why we spend so much time crafting a very natural incision. And we're doing this little series of talking to patients right after their facelift surgery. So this is a patient that we did facelift, lower lid laser. What else?
Mole removal.
Mole removal. There we go. Those three things. And we did this 48 hours ago. So she is 2 days out of surgery. About 50% of my facelifts are out of town. So she's going back to her hometown tomorrow. And, you know, people stay here a variable amount of time. I want to make sure that they're healed and they're not having any problems. So the more procedures you do, you know, you have to stay a little bit longer. But she's done absolutely great. So let's talk a little bit about this. How do you feel 2 days out?
I feel really good. I feel good.
All right. What's are you in much pain?
No, just a little. I'd say 1 on a scale of 10, but it's manageable.
Okay. And so yesterday was the day after surgery. How was that?
Tired. I slept a lot, but I still felt pretty good. Pain was a little bit higher, maybe 3 out of 10, but not bad.
Okay. Very good. You're a little stiff, correct?
Yes, very
All right.
stiff.
So it's really common that patients will say, "Hey, Dr. Joe, I'm scared. You know, I want to know." It's like, how do you feel the day after your facelift, 2 days after your facelift? What would you say to those people? And listen, I don't want you to sugarcoat it, okay? Because I really try and tell it like it is. And I always make the point that, you know, most people do really, really well. Every once in a while, somebody is more uncomfortable. But, you know, you've been a pretty average patient. So what would your advice be? Or?
Pain is different for everybody. Redheads feel it even more, so don't feel embarrassed if you're a redhead and you have pain. But I was fine, and I would say don't worry so much about the pain, because you give pretty good drugs afterwards, and they do take care of the pain. So.
Right. You know, I tell you, I love what I do, and the reason that I love what I do is that I just meet such great people from all over the place, and I really enjoy making them look and feel better. So thank you so much. It's
Thank
been my
you.
honor to be your surgeon. You have a safe trip home.
Thank you.
Okay. So here we are with our patient 2 weeks out, and nice smile. You got a little makeup on today. So it's been 2 weeks since your surgery.
Right.
And it's great. You're taking care of yourself. You're doing your hair. Starting to do your makeup. You got a little bruising and some irregularities here, which is not abnormal for this time. All your stitches are dissolved. So how was it since I think we talked to you at 1 week.
Right. I was here last week, and this is the second week.
Speak up just a little bit.
This is the second week, and it's just amazing how well I've progressed. I mean, I'm really liking the way that I'm looking. He's, I think, shaved about 15 years off of my face. So I'm very, very happy.
So here are some before and after pictures at 24 hours, and you can see the swelling or bruising or lack thereof. And it's extremely variable, where some patients have more bruising or swelling, but most people do pretty well at 24 hours. Obviously, the more procedures that you have, the more recovery you will have, and potentially more swelling and or bruising. And well, some people hardly bruise at all. Other people do bruise, and that's something that's just kind of hard to predict. But these are just selected before and after. This girl took a picture on her way to the office and then took a picture on the way home. Obviously, she wasn't driving after her facelift, so that's the same day. That's kind of wild. And this is a patient that took a before picture coming to the office, and then probably about 6 weeks later took an after picture in her car. So that's interesting as well.